keloid that. What is a keloid in this black child? A keloid is just a thick scar. Can you see this scar on this child's chest? You know, my medical fans, when we were training in medical school, we used to hear that, children don't get keloid, children don't get keloid, until during practice. We now discovered that keloids too, they can occur in children. Keloids, they're very dense, thick scars, which look like nodules, just like this. Solid, raised bump that is firm to touch. It can be like a bumpy area or slightly raised, which in those cases, they are called plaques. And what is this keloid self? Why does it develop at the site of a wound? After a wound heals, some people get this keloid. Why does it sometimes develop at the site of an operation where a cut has been made or anywhere where the skin has been damaged? Why? My medical fans, do you know that although keloids in children are not seen as commonly as in adults, they are seen commonly still in the outpatient clinic setting in Black Africa. And do you know where exactly on the body you commonly can find keloid in children? And the reason why you can find it in these parts of the body in children, keloid, hey, you see it maybe in children older than 10, commonly. But you can see it in children like this too, younger than 10 years old. Yes, this boy is younger than 10 years old. You can even see from his stature and habitus. Because a keloid can develop at any time. An infant can get keloid. People, even older than 70 years old, can develop keloid. But most people start developing their keloid when they have reached puberty. So what are these keloid scars? That's another name for keloids. Keloid scars. After you have damage to your skin, after maybe operation, after a cut, after a scratch, after a wound heals, you can develop a keloid. But, my medical fans, do you know that even after you pierce your ears, you can develop keloid? Yes. You see sometimes in children, they pierce their ears, and at the back of the ear, you start seeing a bump, like this raised bump now. That is how a child can develop a keloid. Even after chicken pox, you remember that skin condition where the children have skin rashes all over their body? Do you know that after that chicken pox heals, that child can develop keloids over all those areas where there were those chicken pox? You can imagine how that child will be looking. The child will be looking very ugly, right? Because there'll be scars all over the chest. Yes. Following chicken pox, the scars can be very ugly because we know that chicken pox scars, there are many over the body. This boy is lucky that he only has just this keloid over his chest, following maybe a wound or a cut or a scratch. And do you know that commonly still, it's not only after injury that you can develop keloid. After infection in that place, that skin can heal by forming this scar tissue that you are seeing here on this page. Boost and Avar Sharafani, hello, I've said hi to you. Are you enjoying this enlightening session on keloids in Black children? Hope you are. So the skin will now heal by forming scar tissue following that wound and then healing, with an infection in that place. Oh, we have said that these scars, they occur, they can flatten and fade over time. Yes, this scar, I'm sure that when the boy had this scar, it was more raised than this before. But over time, it has been flattening and fading away. The color has been improving more. The skin has been improving more, becoming more supple, becoming almost like the near normal skin around the area of the keloid. But sometimes this scar can get very thick and raised. like this. It can even spread beyond the margin of the wound, because I can bet you that this scar, maybe the initial wound was a very, very small wound, and then the scar was around that area of the wound, but then it was now extending little by little as the wound that had healed now became a keloid or a keloidal scar. So, what causes keloid scars? I'm sure you want to know. What even causes all these kinds of keloid scars? These raised, bumpy, nodular lesions on the chest and other places on a child, on a black child for that matter. We don't really know why some people develop keloid scars. Other children don't develop keloid scars, we don't. Keloid scars can affect anyone, but they're more common in certain ethnic groups. For example, you can see it more in Africans. Yes, that is why I'm doing this video on an African. He's an African boy. It's more common in certain ethnic groups like Africans, Asians, or even Hispanics. Keloids are not genetically linked, but they can run in families. Yes, they can run in families. But what are the symptoms of keloid scars? Can you tell me this? Can you tell me? Keloid scars, when you touch them, they're firm. Yes, they're not hard, but they're firm. They're not soft. They're raised like this. They're smooth somehow, sometimes. And as they grow, they can be itchy and they can be painful. Why does it pain? Why do these children have pain? Because of the stretching of the skin as the keloid is growing. If this keloid is over a joint, for example, over the shoulder, over the elbow, do you know what can happen if it's over an elbow or maybe over a shoulder? Do you know what can happen? Okay, I'll tell you. All right? If the keloid is near a joint, the motion of this elbow, the movement of this shoulder, it can be restricted. Okay? It can be restricted. And this keloid in this child may continue to even grow for months or even years. Where can keloid scars develop? On this child, it developed over the chest. But where else can it develop? It can develop anywhere, but more commonly, it can affect the earlobes that I mentioned before. If you pierce the earlobes of a child, they can develop a keloid, especially when that earlobe develops an infection. Okay? And how else? You can also get keloids on the neck, commonly, on the hands, on the forearms, on the shoulders, on the chest, just like this child, on the upper arms. But do you know how keloid scars are diagnosed? How are they diagnosed? How are they really diagnosed? Do they have to do any test? Most times, keloids can be diagnosed clinically. That means just by looking at it and taking a history from the child, you can know whether or not this is a keloid. Okay? No special test is usually required. But if there is uncertainty over the diagnosis of whether this is truly a keloid in a black child, then it may be suggested that we take a biopsy of this keloid scar to confirm. But do we know the treatment options for keloid scars? My medical fans, do you know the treatment options for keloid scars? Especially keloid scars in black children. We all know that there is no cure for keloids if you read widely medically. And surgical removal, sometimes we may not use surgery to remove it, because we know that many times that keloid will now regrow and may come back even bigger than the original one. Unless, of course, you're going to use multi-modality regimens, using different methods to treat this keloid. So there are so many treatment options to help the symptoms of this keloid. Okay? If your child is able to tolerate it, that's another thing, because not all children might be able to tolerate all the treatment regimens that you can offer for a child with keloids. Okay? Sometimes you can do an intralesional steroid injection into this scar. Yes, that means you inject a steroid preparation into this keloid scar. Yes, the aim of this injection is to reduce the pain and itching and to help soften the scar. These can be given in the clinic, maybe like every 6 to 8 weeks, but for younger children who won't tolerate an injection in the clinic, this treatment will require maybe a little day case admission for the injection to be given under general anesthetic. But most times it can be given under local anesthetic. If the surgeon feels that, it's better to remove this keloid, then they'll discuss it with you, the parent. And as I mentioned before, it can be carried out as a day case, but maybe also at the same time under general anesthesia. That means that your child will be asleep when they're removing this keloid. Once the keloid is removed, a steroid, that intralesional steroid, is injected to the new scar at the end of the surgery to try to prevent the keloid from regrowing. But there is still no guarantee that this keloid will not grow back. Yes. And so they will need you as a parent to ask for your consent. It is important that you feel involved in your decisions about your child's care. For some treatments, you'll be asked to sign a consent form to say that you agree for your child to have the treatment and you understand all the kinds of things that it involves. You can withdraw your consent at any time, even if you have said yes previously. If you'd like to know more about details of consent, that one, it varies in different institutions, so always ask your institution. What are the risks of this injection, this intralesional injection into the steroid? This intralesional steroid injection can be painful when it's given to the child. So the child can cry, he can, he or she can resist and all sorts, all right? But afterwards, the pain should settle, especially after taking some drugs, some painkillers. There is a very small risk of infection because this procedure is actually a clean procedure. Sometimes there may be some bruising and then some swelling, okay, following the injection, after the initial treatment. But are you scared about the long-term risks of multiple injections? Are you scared? Because following multiple injections, you can have some lightening of the skin around that keloid area, okay? That is called hypopigmentation, lighter patches of skin color. Sometimes you can even have darker skin patches of color. And sometimes you can see some spider-like blood vessels around that area because of the injection, the constant injection, spider-like blood vessels in the skin. The skin can become thin, and then the keloid can become somehow, pressed inwards. The skin can become so thin that it can even dye part of it. Therefore, in that case, the skin has been damaged by the injection, and this can require some dressing. But that is very, very rare, okay? And so, of course, after the procedure, after the intralesional injection, a small plaster or simple dressing will be applied over the area. And this can be removed in an hour or two at home. It is acceptable to wash and clean the area normally and return to normal activities. Depending on the location of your child's keloid, you may be advised to continue with a scar massage, okay? Or try on, if it was because of earrings, try on clip earrings to apply gentle pressure to the area. But will your child need a follow-up appointment after this intralesional injection? Your child will often require a series of injections to see the benefits from this treatment, okay? So the interval of the injections can vary, sometimes 6 to 8 weeks, sometimes a bit shorter. This may be longer if the skin over the keloid is showing signs of thinning or hypopigmentation, or if the keloid has responded well to the treatment. But as a parent, how can you prevent further keloids from forming on your black child? Avoid unnecessary trauma to the skin. Avoid, piercing of the child's skin, tattoos. Avoid the child falling anyhow, sustaining injuries. So that is the best way to avoid keloid scars. If you enjoyed this, watch the next video. And if you don't want to get sick quickly, please click on the Don't Get Sick checklist. I'll pin it in the comment section just below this video. I love you all. Bye.